Hi dear doctors, welcome to 𝗖𝗵𝗵𝗴𝗿. Myself Dr. 𝗲𝗲𝗵𝗺 and I'm your pediatric faculty. So today the topic of discussion is a discussion that is very important for your university exam, for your competitive exams as well, and that is the esophageal foreign body. I'll quickly take you to this beautiful and very important X-ray radiograph. Can you see here? Can you see that there is a black thing which is coming here? Can you see this black thing? Anything which is black on X-ray is suggestive of air. So this is air. And because this is air, we can see that this tube is nothing but air in trachea. So there are two pipes which pass. One is going to be the air pipe, windpipe, and the other is going to be esophagus. So there is no obstruction in trachea. So the obstruction is going to lie posteriorly, and something which is lying posteriorly is called as esophagus. So this is the esophageal foreign body. This is how you see on the lateral X-ray. But here if you see, although I'm really sorry for this, so if there is obstruction like this also, okay, and obstruction like this also, so this is entirely suggestive of what? Entirely suggestive of esophagus involvement, esophagus foreign body, okay. So this is the topic of discussion for today, okay. So there is no definition or something which is required for foreign body obstruction. It's just the physiological narrowing of the esophagus which occurs because of the foreign body lodgement, okay. What are the common sites? So common sites are actually three. One is going to be upper esophageal sphincter, because already the site is, the lumen is narrow. The aortic arch crossover and the lower esophageal sphincter, because these are the potential sites where already the esophagus is narrowed. So the chances of obstruction are even more. So if it is less than 2 centimeter diameter, they can pass spontaneously, okay. What are the presentations, clinical presentations? One, there's going to be acute dysphagia. The patient, the child is not going to eat anything, and because it is going in the esophagus, and whenever you start to give something to baby, the baby might aspirate, the baby might choke. So there will be choking, there will be respiratory distress which is going to be there. There can be hoarseness of voice as well. Baby is going to vomit it out in an attempt to exempt that foreign body. There will be drooling. There can be a blood-stained saliva also. Because of what? Because if there is injury, the blood can come. So blood-stained saliva, and of course there will be wheezing as well. So the respiratory symptoms are also going to come. So what is going to be there in X-ray? There can be coins and there can be batteries, button batteries also. So button batteries are always double lumened, okay. So if you are seeing something which is double lumened, these are button batteries, whereas coins you can see simply, okay. Then you have got something which is, sometimes metals can also be lodged, so metal detectors can screen those objects, okay. Next is going to be the important part. As a doctor you should know. See, most of the coins, they pass to the stomach within 1 to 20 hours, okay, and mostly at 6 hours they are going to pass, okay. But see, coins are okay, fine. If the coin is going, we generally don't perform surgeries, because that esophagus is the narrowest opening. Rest all the openings like duodenum, jejunum, they are bigger ones. So the coin is going to exempt once after 6 hours it's going to reach to the your stomach. But what is important in everything, in all these things, is, see, the disc batteries. Now the disc batteries, they have got a very huge chance of the damage to the mucosa. They have got a very huge chance of perforation, the disc batteries, okay. And just like the magnets, toy magnets and everything, they're going to stick across the bowel loops. They are going to exert pressure there and cause pressure necrosis. Now once it is necrosed, it might lead to fistula formation also. It might lead to perforation, obstruction, as well as infections also. That's why disc batteries and magnets are high risk things. That is the reason we require the immediate removal. We have to insert a a scopy inside endoscope or something to remove these out, because they might cause obstruction, perforation, fistula, infection, stricture, everything it can cause. How will you manage that? See, if the child is asymptomatic, if it is smooth, if it is small, if it is distal to the stomach, just observe. But if the child is symptomatic, okay, if it's a sharp, if it's a battery, if it's a magnet, Okay, if the size is more than 5 centimeter, then you have to remove it. Okay, and remove with endoscopy. But if there is perforation of some complication has happened, you have to perform the surgery to repair that part also. Now, let me just ask you this beautiful question and end the lecture, that what is the most common foreign body? Most common foreign body lodgement. Okay, I'll give you the answer as well. This is nothing else but the nuts, the peanuts and everything. They are going to go and they're going to get lodged. That's why please don't give peanuts and everything to small little kids. Thank you so much for watching. See you in the next video.